All right. Hi, Danielle. How are you?
Hi, I'm so good. How are you doing?
Good. I'm so excited to be back with you.
Yay, same.
Yeah. So today, I know we're trying to keep these quick, applicable tips that people can take and really use. And since you are our digestive expert, I wondered if you could deep dive a little bit more into how to know just like what is normal and like what is maybe a sign that you have like some more digestive issues that you should really like lean into. So,
Yeah,
you know,
yeah, that's
that would be
yeah,
just
I
kind of
think
like
that's
a quick like
yeah,
quick major issue to just
yeah, for sure. So I think anything that is normal, we'll start there, is pretty much like you have a meal and you don't experience things like indigestion or bloating right after. You don't feel like overly full after eating your meal. Really, we should all be eating and or drinking water and feel good, like feel satiated from that meal, feel energized, not feel like tired or lethargic. You want that food to really essentially empower you from the inside out. So feeling, like I said, energized, not feeling bloated, not feeling gassy, not belching, not feeling overly full. Those are all normal signs that your digestion is functioning optimally.
okay.
And I would say, as far as like bowel movements, going anywhere from like 2 to 3 times a day is healthy, where those bowel movements are essentially like well formed, and they're not hard to pass and they're not loose.
Okay.
So that's like the essentials of a really good healthy digestive tract, and that you are digesting and actually absorbing the food and the nutrients that you're consuming. So those are like some simple signs that, yes, if you checked any of those off, that's good and your digestion is functioning optimally. So that's what everyone's goal should be, I would say.
That makes total sense. So once you eat a meal, and like you gave us some great tips last week on just like what did you say? Not
So
drinking water.
chewing your food, being in a calm and relaxed state. Yeah, those are like the two big ones for sure. And then not also drinking, like you don't want to have a ton of liquids before and after your meal. And during, certainly, you just want to sip on whatever liquid that you're consuming.
Okay.
Yeah.
That was perfect. So those were so helpful last week. And I think, yeah, this gives people a good picture because it's not like we're always talking about how we feel after we eat. And then
Yeah.
it's like sometimes you are really full because you overate, or sometimes you just
Yeah.
something didn't settle. So on a regular basis, like on a daily basis, these are the things that you should feel like, not too full, all those
Right.
things you just mentioned.
Yes.
And then what are some like common red flags like, hey, there might be something going on with my digestion?
Yeah. So a big red flag is definitely having gas. So it could be like internal gas, either that like you're belching, or gas that you're passing within an hour after eating. So that's like pretty much a big one. Any sign of bloating or cramping, which is truthfully probably one of the most common ones that I see. And then obviously any type of like indigestion or heartburn. I think a lot of people think that that's pretty common too. I would say those are the three biggest ones that I see. And then there's a couple like smaller ones where you're having like undigested food in your stool. So it could be like physically seeing the whole form of the food. Or it also could be having like diarrhea after meals or being really constipated. Those are pretty much some big red flags as well. And like I said, there are other smaller things that kind of fall into that category, certain skin issues, things with your hair, your nails that you could notice. But those are definitely, I would say, the biggest ones. And the biggest two would definitely be like gas and then bloating of any kind. So definitely, yeah, if you're experiencing any of those four, then I would say there's probably something underlying going on in there.
Okay, that is so good to know because I think,
Yeah.
yeah, we just aren't really sure what to do. And then, so say for example, you have a client and they come to you with these issues. They feel like they're really bloated after they eat. Or they're having like, you know, some issues with their stool, like they're having diarrhea or something
Mhm.
like that. So how do you, like, what do you do? Where do you even start? I'm just curious to like know. I mean, it's great. The first step is obviously identifying there's a problem, and then
Right.
what happens?
Yeah. So typically, then what happens, especially with my one-on-one, and then hopefully in this new group program that I'm going to launch in April, is that I really do try to have all of my clients do a GI stool test. This is a specific test that you can't typically get in your regular doctor's office. Now, if you're someone that's working with a functional medicine doctor, then they would probably run it for you. But it's a really specific stool test that uses DNA technology to analyze all of the components of your stool and inside your gut microbiome. So we're going to then look for things like sensitive food sensitivity, so things, you know, especially to gluten, looking for parasites, maybe it's some type of bacteria overgrowth, really anything that could be going on in that digestive tract. We want to get a full picture. And I used to not have clients do that. And really what happened was that I would certainly be giving like my best guesses as to what could be going on. And unfortunately, kind of just drug out the protocol for them instead of just getting, hey, here, let's do this panel. It's super easy because you do it at home. And then you send the test away, and we have the results within usually 10 days. And then you can just start working on a complete gut restorative program from there. So I would say working one-on-one, like that is your first step, is getting a full picture of what is going on in your intestinal tract.
That is so, yeah, that makes total
Yeah,
sense. Because then you can narrow it down. You don't have to try eliminating all these things that you
right.
like might have nothing to do with it. If you have like overgrowth of a bacteria, you might actually be
Yep.
feeding something that you don't realize. So
Yeah, it's 100% true. And I think that it's almost a little bit better of like peace of mind when you get the test too, because just like you said, it can be really overwhelming when, you know, other people are reaching out maybe to other nutritionists or dietitians. They're like, I think you should do complete AIP or go like gluten, dairy free, whatever. And it's so overwhelming, you know, for the person to experience that right away where you don't even really know, like you just said, if that is the cause. So it's like, let's not waste any time. Let's do this, figure out what the exact issue is, because it totally will tell you that. It's really comprehensive, you know, 6-page report. And so there's no guessing involved, which is really nice.
that makes sense. That makes total
Yeah.
sense. Yeah, because I think especially with, you know, one of the first things I do with clients is help them to figure out what motivates them and how they respond to expectations and what they need to like make things happen. And there's a big group of people that really need to understand like, why am I doing this? So it's like if I tell them, you know, go to bed earlier, or if I tell them like we have to get a hold of your space in your environment, they're just like, why? And then you pull out some research on like, here's why this causes stress and this. But when it comes to like having a test that can say like, here's why you're, you know, you can skip that toast in the morning because like it's actually affecting you, not like it might be doing this. So I think that gives so much clarity to people who then can put some motivation behind it. Like I can give up anything if I absolutely know it's going to be better for me. If it's just like this might work, then it's hard to really get behind. So that really makes sense. So then
Yeah.
you would be able to prescribe that, and then they would take the test at home and then be able to work with you with as you got the results back.
Yeah, absolutely. Yeah, it's really simple. Yeah, I just, you know, they get mailed off to the clients. Yeah, and they just totally do it in the comfort of your own home, which is really nice too, because let's be honest, nobody wants to do a stool test in a public place or at a doctor's office. You know, it's much easier to do that in your house, mail it off, no big deal. And then, yeah, we kind of just go from there. But it is just really nice, again, like you said, to have a really cut, clear, dry answer as to what is going on instead of playing those guessing games. Because at the end of the day, like you're just going to continue to keep getting really good guesses, but you might not be actually treating the root cause, which is essential because otherwise you're just masking the symptoms as to what's going on.
It's so true. Yeah.
Yeah.
That's awesome. That's so good to know. And so if people want to get a hold of you to like learn more about this, or if
Yeah.
this is for them, when I post this video, I'll put your contact information or they can go.
Yeah. Yeah, that's totally fine. Yeah, either one. I don't know if there might not be like a full description on the website just yet, but I will get that up in the next few weeks. But yeah, if people do have individual questions about it or have taken one, yeah, definitely send me an email and we can connect and discuss further. But yeah, I would say that would definitely be the first step because it's just why waste your time guessing or trying all these different diets. It's just, it doesn't make sense. Just find out exactly what's going on and get to the bottom of it.
Yeah, that's so helpful. And now that we
Yeah.
know that, things like that exist and
Yeah.
how to know if you might need to test. And if you are wondering if you might, then reaching out to
Yeah.
you. Can
Yeah, absolutely. Yeah. Yeah. So those are my top ones, I would say, for you
checking.
know, not optimal functioning digestion. And of course, here and there is normal. Like, obviously, if we're eating really quickly, then yeah, you could experience some gas for sure. But if this is something that's happening, on a regular, continual basis with all of your meals, then that's really where you want to dive deeper and see what's going on.
Check that out. Yeah,
Yeah.
that's so helpful.
Yeah,
Awesome.
good.
Thank you
Awesome.
so much.
Yeah, you're so welcome. Yeah, I love popping on and doing these. I think they're super helpful too. And I think it's always easier to like watch or listen to somebody than spend time reading about it. So I love that we're kind of putting that out there for
I
everyone.
agree. Yeah, and keeping them just to like quick bite-size
Yeah.
bits of information that if it applies to you, then or somebody then
Yeah.
it can really help them. So hopefully,
Yeah, absolutely.
yeah.
Yeah.
Do you have a topic that you want Danielle to cover when it comes to digestive
Oh,
and nutritional therapy, as using food as medicine or using, the way healing ourselves through food? And then please let us know because we'd love
yeah.
to. We just have our little list of digestive topics that we feel like are important for people to know and would be helpful. I know I've learned a ton from her and continue to all the time. So if you think of something that you want to learn a little bit more about, then let us know.
Yeah, I think that sounds great. Yeah, we'd love to hear from you guys. But yeah, thank you so much. I appreciate you having me on.
Yes, we'll see you soon.
Yeah, sounds good. Take care.
Bye.
Bye.